Hi, and welcome to Rogers TV COVID-19 special programming. I'm David Shearman. My guest today is Dr. Ian Arra, the Medical Officer of Health for Grey Bruce, and we're going to get a COVID-19 update. Dr. Arra, good to see you again.
Always good to see you, David. How are you?
I'm well. And, it's hard to believe that we did this. It's been over a year since we started our special programming here on Rogers, and you were one of the first guests. And my goodness, who'd have thought it would have taken this long to move through this pandemic? It's been quite an experience.
Well, many experts in the field know it's going to take that long. It wasn't a surprise. It is a novel virus for many people, but for public health, it's a bread and butter. We're trained to deal with it. But indeed, like you said, these 15 months seem like 15 years for many good reasons. And we have managed in Grey Bruce to achieve full control over the pandemic at almost every juncture of it. And that really goes to the amount of effort that everybody invested, individuals, families, partners, local political leaders, the media. And we will continue, I trust, to manage this pandemic until we put it behind us, hopefully in the coming few weeks and months.
What I noticed recently, there was an outbreak down in Hanover in a rooming house, and that it seemed that very, very quickly everybody was all over the situation. There was a lot of coordination. There was a lot of partnership. And while public health was the lead agency, I believe, that everyone pitched in to make sure that this outbreak was contained. People were cared for, provided for, and it seems to be waning, shall I say?
Yeah, definitely, it is heartening to see the effort from all partners and the community around this outbreak management. Public health leads the management of the outbreak and mobilizes the partners to achieve what we all want, is containment of the outbreak, the safety of the residents in that rooming home, around 35 people who are disadvantaged enough to be using drugs, which adds many layers of complexities. So, whether it is paramedics, the hospitals, primary care, different partners, and I can go, a list is very long, and I'm not going to be able to exhaust it or do it justice, but it is definitely heartening to see everybody mobilized to ensure the basic life needs are met. Whenever we impose isolation, there is ethical duty and practicality of the management is to ensure everybody's need is met, and essential needs, whether it's food or safety from withdrawal and treatment, and all these things have been implemented quite rapidly over a weekend. And I do believe we will maintain this support for this group, and hopefully down the road, as every outbreak is concluded, we write a report with certain recommendation, and I can see there is an opportunity to turn this challenge into benefit for many of the disadvantaged subpopulation we have in our area, and hopefully other places. I wonder, David, if I can lead in a segue from here to
Sure.
a resolution that ALPHA, the Association of Public Health Agencies, has passed early this week, which is a resolution recommended by our board, and I represented it, and it was adopted and passed. And the resolution would say the same success we had in public health to mobilize the community to control the management of the pandemic locally, the same success will be mobilized, so we would capitalize on the momentum and we address the opioid crisis right after the pandemic is done. And to my delight, it was passed, and that means it's a strategic direction for ALPHA, calling on all government levels in Ontario and to make that goal achievable, or implement certain measures to speed up that process to address that crisis.
Well, speaking of the opioid crisis, where are we at in terms of Grey Bruce? One could say that the opioid crisis has always been there. It's been there for a while. I remember hearing Dr. Davila comparing it to 12 jumbo jets crashing a year in Canada, and it's only gotten worse. Where are we at in Grey Bruce? I know there was an opioid alert very recently, but obviously it is a concern. Where are we headed with that?
Definitely. So from public health point of view, and I realize this is not the exact question, but I'll go to that the situation in Grey Bruce. We maintain the core programs to address the opioid crisis in Grey Bruce, whether it's the naloxone or exchange programs, harm reduction, and outreach in certain locations. In general, in 2020, in Ontario and in Grey Bruce, the pandemic put more pressure on people who are disadvantaged related to opioid, and the number of fatality from that epidemic, I would call it, has increased relative to previous years. And in certain areas in the province, it went up to 60-70%. It could be more. I didn't look at all the stats from different parts of the province. In our area, the number of fatalities went up from 16, I believe, in 2019 to 23 in 2020. So that's an increase by 30%, which is significant. And we know that the pandemic has been a hardship on everybody, let alone on people who are vulnerable. So all in all, we continue to manage the core programs or the core functions to respond to this crisis. And I do believe, and as the resolution has passed, that's our strategic direction, to give it full utilization of the partnership that has strengthened during the pandemic to address, to more or less take the momentum from one epidemic to another one.
You mentioned the partnerships, and I've emphasized this in my own interviews with other organizations over and over again, that one of the strengths we have here in Grey Bruce is our partnerships, that organizations work together and they work closely together. And what's even more interesting, as I have said, is that sometimes we do it in spite of the rules. I remember one of our county administrators saying that being sort of asked questions about, how come you did that? Did you get permission to do that? And they said, no, we just did it because it was the right thing to do. So it sounds like that's the kind of approach that public health is also taking. We just do it because it has to be done. Well,
indeed, and this following point is probably going to take us back where we were at the management of the Hanover, but it's a good example of what you mentioned. The role of public health is to ensure services are done. So it doesn't mean that we need to do it ourselves, but if there is nobody else, we need to do it, whether it's our mandate or not. And one of the thing is second dose for shelters. According to the provincial direction, it takes certain time. In light of this outbreak, and knowing that people who use shelters sometimes move from a place to another, I decided to take the heat for it, if there is heat, and provide the second dose a bit earlier to this vulnerable population. And our colleagues, paramedics in Grey and Bruce, have suggested another idea too that we're in the process of implementing it, is to identify non-registered semi-shelters, houses that are used for drugs. The police, the paramedics, our staff sometimes would have to support different populations in these settings, and I didn't see any vaccine or direction to have mobile clinics going there. Nevertheless, we're going to be moving there and giving the vaccine for people who wants it in these settings. So again, a bit rather unorthodox, but I believe it's going to bring benefit to people.
And sometimes that's exactly the word that makes it work, unorthodox. I mean, we hear about the mobile clinics down in the city, but basically what you're doing is taking it and adapting it for the Grey Bruce situation. And I know the paramedics have been out vaccinating seniors, because I know seniors who've been vaccinated and they've been delighted to be able to get their shot in their own home. So this collaboration seems to have worked quite well.
Indeed. The paramedics in Grey Bruce have gone over and beyond. The scope of practice was increased. They participated in swabbing and recently in vaccination. And I remember I was sitting in this office February 2nd, 2020, with the chief of paramedics from Grey. And we were planning early on, even before people knew a pandemic is coming, that this can be utilized. And again, to my delight, the province followed suit in expanding the scope of paramedics during the pandemic for all Ontario.
Speaking of vaccinations, where are we at here in Grey Bruce? Things seem to be. I was just looking at some numbers that show we're going to be getting a lot of the Pfizer vaccine in the next 30 days. It's quite remarkable.
Indeed, Moderna as well. I believe by the end of the month we're going to be getting around 6 million in Canada, or 7 million doses, and in Grey Bruce we will utilize them as soon as we can. We have built capacity since January, started building capacity, and that was nicely completed in March. And again, it's a collaboration with all partners. And we do have the capacity to vaccinate all Grey Bruce within days. At this point, we are at 111,000 vaccines, and that's really good number. We're getting our fair share from the province, despite the fact that we're not hotspots, so we didn't receive the earlier shipments. Nevertheless, we caught up and we're ready to deploy more vaccines and administer as we receive them. Second doses have started now. 70 plus can get the second dose. Anybody with immune system issues can receive the second dose at their convenient time. Again, there is a special clinic on Thursdays for immunocompromised patients or people who are fighting cancer. So it has been a success to see the plans coming to fruition with vaccine rollout.
Well, I'm going to just give you just a brief personal anecdote here that, in fact, I was talking with my producer just before we started the program. He was saying that one of his kids got a call from his employer saying, get to such and such a drugstore because they've got some extra shots and you can get a shot. And that's what worked. In my case, I was supposed to have my second dose in July, but when the province opened up, all of a sudden, my goodness, I'm getting it in mid-June. So things are very, I would describe it as fluid, and people need to pay attention. People need to check that provincial website because if you meet the qualifications, sometimes it's just when you got your first vaccination, sometimes it's your age. You can qualify for a second one.
Yeah, definitely. Like emergencies tend to be, there is pivot and change at every juncture, and information is power, and too much communication is not enough. I would advise every person to spend a few minutes on Health Unit's website, the provincial website. There is information that can help them protect themselves, their family, and the community.
For sure, and to maybe check from time to time the vaccine appointment booking site, because if you meet certain qualifications, you may be able to get your second shot a little earlier than you might have expected. Indeed,
there is a change every day, and again, there are different clinics, different qualifications, different eligibility criteria, and they keep changing, and they're changing to speeding up the process more or less. There's more vaccine coming.
Yes, Yes. Now, speaking of the clinics themselves, I have to say I went to the first public hockey hub clinic in Hanover to get my first shot. I was very impressed with the speed and the smoothness and the everyone was just moving around and doing the right thing, and you were in and you were. I think the longest time was. There was a bit of a lineup, which was not unexpected because it was early. It was in the early days, but I've talked to people who have worked as volunteers in the clinics, and they're saying that this is a great experience. That people are able to get their shots, and it's very smooth in and out. It's good.
Well, I hope I don't sound immodest, but it's definitely a system that's a paradigm shift from the traditional clinics, and it is patient-centered. When we talk about patient-centered, we make in the system incremental changes, slow changes, but in the pandemic, we really need to have a complete shift to accommodate the number of people need to be vaccinated. So a person would arrive and the service would come to them. And for that to happen in a timely way, we have to have it orchestrated, not just organized. And again, it's all the partners around the table. Bruce Power have contributed for the equipment, the municipalities donated the arenas, the paramedics, the volunteers. We have over 450 volunteers, and we had to actually put a cap because the goodness in the community, everybody want to participate. Then you look at the time processing. You mentioned the time. Anytime a person would walk into a hospital and walk out, it takes 40 minutes just for the trip itself, regardless of the service. And we know that time is a variable in the risk of transmission. The shorter the window of time, the less risk of transmission. So we aim for 20 minutes. Most of the time it works. Sometimes it increased by a few minutes. Nevertheless, the interaction is minimal. A person is sitting in one spot, not in 3-4 spots waiting. So it is definitely a system that has proven to be practical and safe and effective in providing more vaccines. We have had knowledge sharing session with other health units, other jurisdictions, including Alberta, Manitoba, New Zealand. So obviously, Grey Bruce does it right.
Now, you said something about a road trip regarding the hockey hub model. What's that about?
Yeah, so Bruce Power supported the Peel Public Health with building a larger scale hub, maximum of 9,000 doses per day. So it's double the size of Hanover. And we have shared the knowledge and even sent few staff on the ground in Peel to support with that process. And recently we received a request from Peel Public Health if we can send the entire team to ramp up the operation and demonstrate how we can change the management of a clinic in a successful way. And that knowledge is going to be shared there, obviously, but we also provide the vaccines to thousands of people in one day. So it's an exciting time. Definitely our staff said yes. We have a day this Saturday that we don't have any clinics here, so the entire team is going to go on a road trip, and I'm confident we're going to deliver.
Well, I have to say that when I got my first shot, the nurse who was doing the injection was actually excited about the work she was doing. As she said, normally I do something back behind. I don't have a lot of face-to-face management or face-to-face encounters with clients, but I can do this. And she was really quite pleased to be able to do it because I think it was making a difference and she could see it. And there was an atmosphere of, okay, we can do this. We can get this done, and we're not gonna panic. We're just gonna we're going to. I'd hate to use the word enjoy ourselves, but we're going to be pleasant about all of this experience. So it was good to. It was from a patient's perspective, from someone who got their shot. It was a great experience.
Definitely. Sometimes I think of adjectives and nouns, and probably the most fitting here is the sense of fulfillment and sense of industry. Usually a vaccinator, a nurse, or physician can vaccinate 6 to 10 patients per hour. In this system, it's 70 to 90, which means, by the end of the day, somebody can vaccinate 800, 1,000 people, which is unheard of, and would allow us to have that, like you're right, it's not joy per se, but fulfillment. And the fact that we can deploy more skilled workers, skilled clinical workers into the hospital system in the clinic where they're most needed. 5 people can vaccinate 5,000 people per day. So that's a lot of efficiency. We can deploy our staff to do contact tracing and management and other tasks. Usually early on the shipment that we would receive around 4,000 doses per week, we can administer it in one day. And that gives us all the time, and it did give us all the time to respond to contact tracing and other services. So all in all, it is a really good experience. And David, I had concern when I was designing the system that the interaction between the healthcare worker and the patient is minimal, 30 seconds or so. And would this take away building the rapport and the therapeutic relationship there? And again, I was pleasantly surprised that our staff have the ability to adjust their skills to shorter period of time. Even the nice gesture, the tone of voice would put the patient at ease. And I did an anecdotal survey early on when we were experimenting with vaccine, not experimenting with the system giving the vaccine. And again, 6 out of 6 said they had that sense that they were taken care of. And again, that reassured our staff, because one of their earlier concerns, will the patient see me as rude? And that's where communication, describing what the system is and describing the aim that we don't just want to vaccinate you in 2 minutes. We want to vaccinate you in shorter period to vaccinate the rest of the family and the community. And again, it takes sometimes a pandemic to change the practice in medicine in certain aspect, and we're glad to be leaders here. Our staff really committed champions, and they're going to pass that knowledge to field staff, and that's going to be better, earlier end of this pandemic to all of us.
Well, we've got just a few minutes left, but I wanted to look forward, because we're now moving, as we're taping this, we're just on the cusp of moving into step 1. 21 days later, all things being well, we'll be in step 2, and 21 days after that, all things being well, we'll be into step 3, we hope. What's your take on where we'll be? Do you think, I know vaccinations are ramping up, they're continuing to accelerate. Are there any cautions that we need to be aware of going forward through the summer?
Definitely, we're not out of the woods yet. We have maintained full control over the pandemic almost most of the time in the past 15 months. The 3 W's, washing hands frequently, wearing a mask correctly, and watching our distance, have been key to ensuring the safety of all of us and the community. And we need to be committed to this a bit longer. This is a home run. I anticipate, and I've said this early on, this summer will be the end of the pandemic, and the vaccine is the tool to go forward. So keeping the 3 W's, getting the vaccine as soon as we can, 2 doses, is what we all need to do. And that's going to ensure this pandemic is behind us. But we're not out of the woods yet. Again, we need to be committed to this a bit longer.
Do you have any concerns about the summer traveling, about tourists, about crowded beaches this summer?
I do have concern. It's a pandemic. We need to be concerned about almost every aspect, especially the variant. The variant is a wild card. We look at our experience from the past year. We have managed in Grey Bruce optimal control, including visitors who came to Grey Bruce. There was a lot of concern about the spring and the summer. And, that period passed, and there was not documented case of transmission from a visitor to a local in a tourist area or in one of these recreational activities. The bulk of transmission happened within families or between friends and families. So we have confidence that the measures we implemented last year would work this year. The variant might be could be a wild card there, but I don't believe it's going to change much of that trajectory. Nevertheless, the measures in place from workplace and from different businesses, vigilance from all of us in what we do, and the vaccine, and hopefully this will be the end of this pandemic in the near future. And I realize masks are not pleasant, and we got accustomed to them, but there will be a point in time in the near future, I hope, where we can rip them off and enjoy the normality of our life that we longed for and that we invested a lot of effort to regain.
For sure. And that's good to hear that in time that we'll be able to take the masks off and maybe get a little closer to each other and shake hands and wash afterwards, those kinds of things. But that's good to hear. And I know, having talked to the school board, they're looking forward to being back in school in September with maybe some new ways of learning. But at the same time, they're planning to certainly look forward to being back in school.
Yeah, definitely. The pandemic changed our perspective of life. Sometimes, David, I look at certain aspect, simple joys of life. My parents hugging their grandkid, and we cannot do it right now. But I do believe if we're all committed to it, it will happen in the near future. The restrictions have been lifted by different agencies, different jurisdictions, gradually lifted, I should say. And we will reach a point in time where the vaccine would end the need for these restrictions. Wearing a mask down the road for common cold, not for COVID, is not a bad habit. Now, socially, it became a bit more acceptable, a lot more acceptable comparing to before. And carrying some of these healthy habits might not be a bad thing going forward.
Well, come to think of it, I didn't have a case of influenza this winter, which is a first for me. And I attribute it, of course, to the isolation, but also wearing a mask. So anyway, we'll just have to see. Dr. Arra, thank you so much for your time today, and best wishes as you move forward. Enjoy the road trip for the Hockey Hub, and I'm sure we'll be talking again. Thank you. And thank you, friends, for being a part of Rogers COVID-19 special programming. I'm David Shearman. We'll see you again.